This is based on Davidson's Principles of Internal Medicine, Chapter 32. What is maternal medicine? It is an intersection of medical disorders and pregnancy. Pregnancy change disease presentation and the treatment. As per Davidson, pregnancy is a physiological stress that may unmask latent medical disorders or worsen pre-existing disease. That is the importance of maternal medicine. Maternal disorders are major cause of morbidity and mortality. More women with chronic disease survive out to reproductive age. So we are seeing more patients with medical disorders and pregnancy. Physicians must adapt care to pregnancy physiology. So what are the key physiological changes that is occurring? First we take cardiovascular system. The blood volume increases around 40%. That is so many diseases like Wilder disease gets worsened during pregnancy, or they may become symptomatic for the first time during pregnancy. The cardiac output increases by 30 to 50%. So patient develops a hyperdynamic circulation. The systemic vascular resistance comes down. That is because of the vasodilation. Then this may lead on to occurrence of physiological murmurs like the flow murmurs. They can have angle edema and mild tachycardia. So I already mentioned this is a hyperdynamic circulation. Then now take the respiratory system. What are the changes that occur in the respiratory system? The tidal volume increases. So the minute ventilation increased by 40%. So because of the hyperventilation that is occurring, the PaCO2 comes down to around 30 millimeters of mercury. So it is usually 35 to 45 millimeters. It may come down to 30 millimeters. So it is common to have physiological breathlessness. So many pregnant patients, even without any cardiac problem or respiratory problem, can have some amount of breathlessness. That is common. Now take the renal changes. What are the renal changes that is happening? The GFR increased by 50%. So remember this point, the GFR increased by 50%. The serum creatinine comes down. It becomes 0.4 to 0.6 milligrams per deciliter. So creatinine comes down, GFR increases. Even normal values may signal disease in pregnancy. So that is the important point to be remembered, because the serum creatinine comes down, the GFR increases. So normal GFR and normal serum creatinine can be abnormal in a pregnant person. Now take the hematology and metabolic. The plasma volume increases. So what happens? There is a physiological anemia because the volume increases. We already said that there is increase in the blood volume. So this leads on to a dilutional anemia. Pregnancy is a hypercoagulable state because of the increase in the clotting factors. There is increased insulin resistance. So the patients can have a tendency to have hyperglycemia. So what are the clinical relevance? Pregnancy changes may imitate or mimic disease because that produces angle edema. They may mask disease. Example, they can have the patient presents with tachycardia. So this may be confused as a normal thing. The altered pharmacokinetics, drug dose adjustments are required, especially drugs like anti-epileptics. The volume change and the other metabolic changes that is occurring may lead to changes in the drug dosages. Now we go to a few MCQs. Which is a normal physiological change in pregnancy? Decrease in cardiac output, we have already mentioned. Cardiac output increases. Fall in systemic vascular resistance, that is the correct answer. PaCO2 decreases, GFR increases. So the correct answer is, we have already mentioned, there is a fall in systemic vascular resistance. Other answers are wrong. True or false? Plasma volume increases is the correct answer. Serum creatinine rises. It is wrong. Serum creatinine decreases. Pregnancy is hypocoagulable. Wrong. It is hypercoagulable. Take home essay. Pregnancy is a physiological stress test for the person. You should know the normal changes so that you can identify the pathology. Always interpret the lab results, especially serum creatinine, GFR, etc. in the setting of pregnancy. The best outcomes in maternal medicine are achieved when both obstetric and medical perspectives are combined. We'll continue with a session, hypertensive disorders in pregnancy. Stay tuned.